by Sullivan County Commissioner and United Air Force veteran Brian Hoffman. I am Julie Gavitt Schaefer, Sullivan County District Attorney. Many of you who know me know that I am driven to help people. Many of you know that I am also driven to feed people. Today, I get to do both. We are here to launch the behavioral health expansion of the Sullivan County LETI program. LETI stands for Law Enforcement Treatment Initiative. We are honored today with the presence of Attorney General Dave Sunday, who saw the need and took the initiative to create this valuable program available to district attorneys throughout the Commonwealth. Thank you, Attorney General Sunday. We are also honored with the presence of the State Director of the LETI program through the Attorney General's office, Lauren Diller. The work she is doing to establish our program, together with her expertise, dedication, and organization, are extremely helpful and greatly appreciated. Thank you to all of the team members of the Sullivan County District Attorney's Office, including ADA Kenneth Osako, ADA Jeff Mitchell, Office Manager Paralegal Cecily Tuba, and Victim Witness Coordinator Amanda Hoover. Thank you also to Melanie Parrish for assisting with today's festivities. I believe I have the best team in the Commonwealth of Pennsylvania, including 2 assistant district attorneys who are former DAs, both with decades of experience, and an office manager paralegal who is extremely talented and dedicated. Welcome all attendees. Wyoming and Sullivan County Common Pleas Judge Nina Sordoni, Magisterial District Judge Jennifer Van Dyne, Wyoming County DA Joe Peters, Luzerne County DA Sam Sangalduce, and Lycoming County DA Tom Marino. LETI coordinators from Monroe and Clinton counties, law enforcement including Pennsylvania State Police, Sullivan County Probation, Sullivan County Sheriff and deputies, Game Commission and DCNR, mental health professionals from all of our agencies and providers, medical providers, drug and alcohol professionals, county officials including commissioners who have been supportive of our initiatives and outreach, our coroner and children and youth caseworkers, victim services, school officials, rehab representatives, employers, local clergy, community members, and EMS first responders. Thank you all. Your attendance is meaningful to us, and your support of these programs is a vital part of our efforts. Partnerships with agencies, professionals, and the community enable us to connect people with services and get them the help that they need. We launched the original LETI program 3 years ago to assist individuals suffering from substance use disorder by introducing them to treatment. By providing individuals with treatment opportunities through this program, we are not only improving the lives of the individuals receiving treatment, but also their families. In addition, our entire community benefits from the program by reducing deaths, overdoses, and crime associated with drug or alcohol addiction. In connection with our expansion of our LETI program, Director Lauren Diller has assisted us in improvements to our existing program, including designing a portal for referrals from law enforcement to improve communication between the DA office, the case manager, and the providers. Today's expansion of our LETI program is for people in need of mental health instead of incarceration. Through this program, law enforcement officers have the option of referring individuals to mental health treatment instead of charging them. In addition, prosecutors can refer individuals to mental health treatment and withdraw existing criminal charges upon their compliance and success. As we strive to improve the availability of services, I am pleased that our partner agencies are instituting promising improvements to our behavioral health services delivery as well. There will soon be a new provider of behavioral health services here in Sullivan County. The Wyoming and Sullivan County Court of Common Pleas is working to create a mental health court. Concern has a new 24/7 number for law enforcement officers to contact when they encounter someone in need of emergency mental health services, instead of struggling to find out what provider is on call through the comm center. And the creation of a new crisis intervention team. For more on this new initiative, I'd like to introduce Daniel Kazale.
Good afternoon, everyone. My name is Daniel Cazale. I'm the Assistant Director, Bradford Sullivan Drug and Alcohol. Just want to say thank you, everyone, for joining us for the LETI launch today and for your commitment to strengthening public safety and community partnerships across our region. I'm pleased to share that Sullivan and Bradford counties are working together to establish a crisis intervention team, or CIT, program. CIT is a collaborative approach that brings together law enforcement, mental health professionals, healthcare providers, first responders, and community partners to improve responses to individuals experiencing a mental health crisis, substance use crisis, or other behavioral health challenges. The integration of the crisis intervention team training into Sullivan County's law enforcement, the Sullivan County Law Enforcement Treatment Initiative, it'll strengthen our ability to connect individuals experiencing substance use and mental health challenges with the help that they need. By equipping officers with advanced de-escalation and crisis response skills, we can reduce unnecessary arrests, improve public safety, and increase access to treatment and recovery services. Thank you for your support as Sullivan and Bradford counties take this important step towards creating a more compassionate, informed, and effective response to behavioral health crises. Thank you.
I thank Daniel Cazale, Janera Kebler, and all of the team members who are so dedicated to making a difference. Now I am honored to introduce Pennsylvania's Attorney General, Dave Sunday.
Thank you so much. Thank you. Good afternoon, everyone. It's an honor to be here, and I just want to take a minute to thank District Attorney Julie Gavitt-Schaefer for all of your hard work, for your dedication, and for thinking in a manner that moves the county forward, because the reality is, if we don't work together on these issues, we will never get ahead. And I promise you that this doesn't happen everywhere. And so for everyone that lives in the area and in the region, please know that we're all working together to do amazing things. So by way of background, I have my notes in front of me, and I've chosen to pull an audible today. So I was for a long time a prosecutor before I became the Attorney General. I was an elected district attorney, just like my friends in the front row right here. And I know that we've all talked about this many times collectively, but at the end of the day, our goal is to do everything in our power to make our communities safe. And if our communities aren't safe, literally nothing else matters. And I spent the vast majority of my career in a courtroom trying cases similar to this in a different county. I was the DA in York, Pennsylvania. And so all those years of trying cases and watching defendant after defendant get convicted and go to prison was something that really had an impact on me. It not just had an impact on me, but my colleagues. It had an impact on all of the law enforcement officers that we worked with every day. And we sat down many, many years ago, and I think similar conversations were happening all throughout Pennsylvania. And the question was, what can we do to break this cycle? What can we do to help people so that they don't commit crimes and they don't get arrested in the first place? And collectively, we came together and we focused on addiction. And so we did everything we could as a District Attorneys Association, working together all throughout the entire Commonwealth to find ways to help people get treatment that were in the throes of addiction. Because everyone here knows that addiction doesn't stop at certain counties, certain families. It's everywhere. It's impacted all of our lives, and it's impacted mine. And so we did everything we could to bring people together to help get people into treatment, so that once they, hopefully, God willing, they didn't commit crimes in the first place, but if they did and they came out of prison, they were in a place for success. Well, as the years went on, we discovered that there were many other aspects to these individuals that were having difficulties in their lives and committing crimes and whatnot, and that came down to behavioral and mental health. And I will tell you that we absolutely have a crisis in Pennsylvania with regard to behavioral and mental health. We absolutely do not have enough treatment out there. And in accordance with that, we looked at our LETI initiative, and the information is up here, which we're very, very proud of, and said, what can we do to expand it? Because the whole concept of LETI and why it works is that it's driven locally. It's put together by the county where it operates. It is a tool for law enforcement, which is why it's Law Enforcement Treatment Initiative. It's driven by police. And we asked ourselves, what can we do to give them another tool? And that tool is behavioral and mental health. This is the 9th county in Pennsylvania to embrace this new portion of the LETI initiative. And that's why I couldn't be more proud to be here to be supportive. I know that when I was a DA in a county, I always wanted the state to be supportive of me and not necessarily tell me exactly what to do. And so that being said, we've chosen to do that. And it's an absolute honor to be here with you. I'm so proud to be supportive of this initiative, and I cannot wait to watch how it goes and to see people get into treatment for mental health, because God willing, we can keep people from going down the path in the first place, and those that have, we can do what we can to get them treatment so it doesn't happen again. We can keep families together and lower the crime rate. So it's an honor to be here, and thank you for all of your leadership and support. This is fantastic. Yep.
Thank you, Attorney General Dave Sunday, for being here today and also for having the insight and dedication to establish this program for us. We'll now present a recorded message regarding the need for this program from our public defender, Patrick Johnson, who couldn't be here today.
For those of you that don't know me, my name is Attorney Patrick Johnson. I am the public defender in Sullivan County and have been for the last 18 years. I want to thank District Attorney Gavin Schaefer, along with Attorney General Sunday, for giving me the opportunity to say a few words today. I apologize I couldn't be there in person. I had a pre-planned vacation, didn't know this was going to happen at the time that I planned it. But I wanted to speak a little bit about the expansion of the LETI program into the mental health arena. In my experience as a criminal defense attorney, there are one of two things, and sometimes both, present in almost every case: drug and alcohol abuse or mental health issues. Many times it's individuals self-medicating their mental health issues with drugs and alcohol. In other cases, the mental health issues, they manifest themselves through violence, assault cases, or angry outbursts. But what we've learned is that simply charging and incarcerating these people does not solve the problem. The expansion of the LETI program into Sullivan County and the ways in which mental health services will be delivered is a huge improvement to the northern tier in general and to Sullivan County that I hope will provide individuals with a faster route to the help that they need. It will also help law enforcement, who already have a difficult job, have another resource to try and deal with these issues rather than just simply incarcerating them, putting them in a correctional facility, and waiting until they come out and do these things again. So it's a great day in Sullivan County. I thank everybody who had a part in this, and I look forward to seeing how the program works in this beautiful little county. So thank you all again for the time to say something, to all the guests for taking the time to be here. Hope you enjoy yourselves, and have a good day.
We want to be tough on crime, but we also will also be compassionate, not only toward the victim, but also an offender in need of behavioral health services or substance use treatment. And now I'll ask for a few comments from our Court of Common Pleas Judge Nina Sordoni.
Good afternoon. It's a pleasure to be here with everyone today, and I bring greetings with me from our President Judge, the Honorable Russell Shurtleff, who's sorry he couldn't be here today. However, this is really a celebration to add the LETI program to the court system. As many of you know, we currently have treatment programs in both Wyoming and Sullivan County that include DUI court, drug and alcohol treatment court, veterans court, and Judge Shurtleff has been working on mental health court, so this certainly goes hand in hand. When cases come before the court, we are bound by sentencing guidelines, and these programs allow other alternatives that really go to the root core of the problem. Incarceration doesn't always address the problem, where through our treatment court system and the LETI program, we're really addressing the problem, and we're returning somebody into the community in a far better place. So we're keeping Wyoming and Sullivan County safe. It's great to now that the 44th Judicial District in both counties are part of this initiative. So I'd like to commend our District Attorney, Joe Peters of Wyoming County, and also Julie Gavitt-Schaefer for jumping on this initiative, and of course the efforts of Attorney General David Sunday in, as he indicated earlier, it's really just working together to make our community safer, and on behalf of the court, we're grateful to be a part of that. Thank you all.
Thank you, Judge. As Lauren Diller has stated, for all those times we wish we could do more for them, we now have a way. Again, in her words, sometimes to get from here to there, you need to build a bridge. Thank you, Lauren Diller, for all of your help in designing Sullivan County's program and also the great strides you have taken to improve our original LETI program and also suggesting and implementing improvements to delivery of services here. You have done so much to provide us with the tools we need to succeed. Thank you for building our bridge. And finally, I'm pleased to introduce LETI State Director Lauren Diller.
Good afternoon, everyone. First, thank you to District Attorney Julie Gavitt-Shaver. I have to tell you, when she asked me to speak, my first thought was surely there was someone much more excited about microphones than I am. But I couldn't say no to someone who's been nothing but kind and so supportive. Today marks something special. Many of you know the Law Enforcement Treatment Initiative, or LETI, as a program built around helping individuals affected by substance use disorders, a remarkable foundation laid by my predecessor and someone I deeply respect, Dr. Janine Holter. Since its inception, LETI has been grounded in one simple belief, that law enforcement can be more than just a doorway into the justice system. It can also be a bridge to hope, treatment, and recovery. As we've worked alongside communities in Pennsylvania, one thing has become abundantly clear. People don't live in categories clearly defined by mental health or drug use. Life isn't neat, and unfortunately, we as law enforcement see these individuals on their worst day. Their mothers, fathers, sons and daughters, veterans, neighbors, and friends, and often the challenges they face overlap in ways that require us to work together rather than in silos. So today, we celebrate an expansion, not just of a program, but of a philosophy. This next chapter recognizes that behavioral health matters. It recognizes that crisis deserves compassion. It recognizes that early intervention saves lives. And it affirms something many of us in this room have known all along, that public safety and public health are not opposing forces, they are partners. I think about the people whose lives can change because someone took the time to answer the phone, make a referral, offer support, or simply say, we're not giving up on you. And that's what makes today so extraordinary. At the end of the day, this work has never been about the programs. The truth is, LETI doesn't succeed because of the policies we craft on paper. It succeeds because of the people. And that's what, people like the leaders gathered here today and our law enforcement community. People like the Sullivan County team, whose willingness to embrace innovation and collaboration has made this expansion possible. Karen Laboranti, Daniel Kazale, Shannon Cahill, Mame Carter, and various crisis team members from Concern. Agent James Hinton and the Pennsylvania State Police Troop P, and also thank you to the Sheriff's Office for your dedication today. And especially to District Attorney Gavitt-Shafer, whose vision, compassion, and steadfast support have been evident every step of the way. Your belief in this mission, and frankly, your belief in me, is something I treasure deeply. And to Attorney General Sunday, the man who signs my paychecks, thank you. I am deeply grateful for your steadfast commitment to the people of Pennsylvania. Your leadership has demonstrated that compassion and accountability are not competing ideals, but complementary ones. Through your unwavering belief in redemption, treatment, and second chances, paired with an equally resolute commitment to public safety, I'll get there, you've helped foster communities where hope and responsibility can coexist. Pennsylvanians are better served because of that balance, and I am profoundly thankful for your support and vision. Thank you for allowing me to be part of this journey, and thank you for continuing to build communities where compassion and accountability can coexist and where hope always has a place. Thank you.
As District Attorney, I not only have the responsibility of prosecuting crimes, but I also have the opportunity to change people's lives. Our original LETI substance abuse program, together with a newly added mental health program, will build upon and complement the programs already in place for our county. It will make better use of our partnerships with the single county authority and our mental health professionals. And by increasing the ability of people to connect with services at the earliest stages, we can really make a difference in the lives of those with behavioral health needs, a difference in their families, and a significant difference in our community. We'll now have ice cream, brownies, and strawberries in the main hallway, and our commissioners are providing popcorn. Please join us, and thank you again for your attendance and interest.
Great job, great job.